They're going to cut the NHS? Yeah, that sounds about right. The health secretary also admitted there would be significant job losses, adding that he was, quote, genuinely sorry that people working for NHS England would be, quote, deeply anxious about their jobs. Hey, pardon me if I've forgotten this. Can somebody remind me, is there any vertical integration in the NHS, or is it just another like Medicaid, Medicare kind of thing where the government just pays private corporations for all of their services, medicine, et cetera, et cetera? No, it's run by the state, right? So as in the state is producing the medicine, not buying it off private corporations. The state is not just paying the doctors, but all the services they get and the resources they get. The government owns the NHS. No, I'm not asking if they own the NHS, not the pharma. Okay, so they own the services, not the pharma. No, Vosh, no, that's wrong. That's remarkably unhelpful. You work for the state. I know that. I'm talking about you'll have a government-owned hospital with public sector doctors, but maybe the X-ray department's outsourced. There we go. The outsourcing. Yeah, how much it's privatized. And how much does the NHS even cost? Like, if you're keeping everything in sector like that, or most things, you're only making stuff more expensive by privatizing it, which I guess they've been rapidly privatizing it. Total NHS spending. Okay, the National Health Service is addicted to overspending, Wes Streeting said. But in like what way? In 2022 to 2023, the Department of Health and Social Care spent $181.7 billion on health services, with the vast majority, 94.6%, or $171.8 billion, going towards day-to-day items like staff salaries and medicines. That sounds good. That sounds good. The spending was $181 billion for an entire year to provide health care for the entire nation. Population of UK. Just do that math right there. 68 million. In the United States, 330. We'll just simplify the math a little bit and say that we have 4 times the population, even though that's not correct. 4 times the population, you'd expect us to spend 4 times as much. 4 times 181 billion is, what, like 720 billion? We spend way more than 720 billion. Annual health care spending, USA. 4.9 trillion. So going by like some very rough numbers here, it seems like the NHS is actually running at a pretty threadbare, again, I know it's very simple calculation here, but like it seems like they're doing all right, you know? Is he sure he isn't using pounds for the UK's cost? Unless a pound is suddenly like worth 4 times a dollar, I don't think those numbers are equalizing. Soon? Yeah, soon. There probably is a lot of unnecessary bureaucratic red tape. It's very low versus other countries with similar coverage. I need a Statistica account for unlimited access. No, I don't think I will. It's just been getting more and more expensive because of privatization. How do we track NHS spending non-NHS private expenditures? Like, 1 second. UK healthcare spending per GDP, per GDP, per capita over time. UK healthcare spending per capita has increased over time, with real terms expenditure rising significantly, presumably because of the privatization. Yeah, here we go. Look at that. It's been skyrocketing. And this is total healthcare expenditure, not government spending. So as they privatize more and more and more of the NHS, it's like, you know, yeah, you go into your doctor. They underfund the NHS, so everything takes forever. But then they like outsource you to a private specialist anyway. Man, I love capital. I love capitalism, man. It's great. It's going great. They're a perfectly functioning system. Well, not perfectly, but... And now they're using it to justify privatizing it completely. Yep, it works the same way every time in every country. It's the same goddamn system. Every time. Working as intended. This isn't privatization, though. It's bringing it under direct state control. What do you mean? They haven't been nationalizing more and more of the NHS. They've been privatizing more and more of the NHS since like the 80s, right? Well, I guess the process might have been going on for longer than that, but my understanding was that since Thatcher, they've been selling off larger and larger blocks of the NHS, essentially like saying like, oh, you know, we're going to like subcontract. We're going to, before, like if you needed a specialist, you would go to an NHS doctor, but now you have like a privately operated specialist that you go to. NHS England is a middleman organization, not a government agency. What the f are you talking about? We're talking about the privatization of the NHS. What are you talking about, NHS England middlemen? Bosh, NHS England is not that. Well, I'm sorry. Am I being overwhelmed by bots? Is there any particular reason why everyone in chat has suddenly started repeating a talking point that's irrelevant to the broader argument that I'm making about the cost of privatization? I'm sorry. Am I having a stroke? What the f does that have to do with what I'm talking about? I'm not talking about any specific subset of the NHS. I'm talking about its privatization. The botnet just activated. Jesus Christ, the swarm. I see a bunch of red dots in the shadows. This isn't the cost of privatization. This chart correlates with aging population expenses. That is absolutely not true. The idea that aging population expenses would jump 4 times or almost 4 times in 20 years is just not, that's just not true. It's demonstrably the case that the privatization of the NHS has led to more people spending more money per capita paying for the private end of their treatment. Prove it? Dog, I've been doing this for 5 years. You can Google that shit. What do you mean prove it? Prove it to you specifically? What are you invested in the alternative? You don't like the idea that privatization might increase the cost? How could it not? It's definitionally less efficient. Private companies look to make profit. The government doesn't. I mean, the government will try to get it if it can, but certainly it's not following the same set of directives. He also thinks too many people are getting mental health diagnoses, too much overdiagnosing. It doesn't take that long or that much money to get a mental health diagnosis. You mean like for anxiety or whatever? Shit's easy. The point is that NHS England is a private org created by conservatives to privatize the NHS. Abolishing it here is bringing it back under the state-controlled NHS umbrella. Okay, so you're conceding the point then that you're just not talking about what I'm talking about. Like I'm talking about the NHS broadly, and what you're doing is insisting on a point that isn't the thing I'm currently talking about. But NHS England is the subject of the article you just read. What am I looking at right now? Look, okay, this is a communication issue, okay? This is like basic communication. Rather than saying, no, you're wrong, X or Y, here's a thing you're not talking about right now, you have to say, with regard to the previous article, just to let you know, this is what they're doing. It's really simple. I know that for you, like, you're just watching a video that's happening live. So you have a sort of like a non-contemporaneous exposure. You have like a different perspective on how this plays out. I'm a guy in shorts sitting in a computer chair. So when you say something like, here's a bunch of talking points irrelevant to the specific thing you're talking about at this moment, I get confused. I'm only human, man. You have to frame your shit properly. It's like when people say, no, that's wrong, and what they're referring to is something I said 16 seconds ago. What the f are you talking about, no, that's wrong? I'm on like a different point now. You're not that well read in the issues facing the NHS, dog. Privatization is an issue, but it's not the issue. Wait, so you think privatization is an issue? Then what the f are you talking about right now? Yeah, everyone wants a fight. Everyone wants a fight. And I'm just here. I'm just here in my shorts. I don't get it. I'm not fighting you, I'm helping you. By saying privatization isn't what's increasing the cost, but then you admit that it is a problem increasing the cost. I don't get it. I mean, you must be British because you have like a very direct tie to this, I guess. Like it inspires in you a lot of passion, which I respect. But I guess if I was in like a dying country, I would also be mad and lash out at people. And I know that because I'm in a dying country and I've been getting mad and lashing out at people lately. So basically what I'm saying is I'm right there with you, brother. Listen, I get it, okay? There's no hope. I understand. You shouldn't take that out on me. And I shouldn't take that out on people either, to be clear. We're all just doing our best. Okay, so the article, then, we all want me to look at so badly, even though I was looking at this, which, if you'll note, is a different URL than this. So you can look up in the, right here, it's a different thing, but now I'm looking at this. Okay, so just to keep, we move forward at 1 second per second. Okay, that's like the pace at which I tend to take things, you know?
Some of them concluded on the numbers they're being given that they're going to have to get rid of frontline staff, that doctors and nurses are going to have to be shed quite quickly because of the budget. Can you look me in the eye, or look our listeners in the eye, as it were, and tell them that isn't true?
Well, there'll definitely be some changes because, I mean, today, for example...
losses of doctors and nurses.
Well, firstly, we should not be losing frontline staff and services because we have got, I think, a bloated bureaucracy and layers of bureaucracy.
Listen, we both know that I'm not talking about bureaucracy. I'm not talking about the office jobs. I'm asking you to say whether or not you think doctors and nurses will have to lose their jobs because of what's happening, because of the budget.
I can't say there'll be no changes to services. But for example, we've put now almost 1,000 more GPs onto the front line since we came in.
You're the most straight-talking member of this government. Can you just say to me, some doctors and nurses, sadly, are going to lose?
It's crazy how this country is dying, but the press over in the UK are still more direct with their politicians. Like, it's American press who are uniquely cucked to the ruling administration. Like, they won't even remotely challenge them. That's cool. Okay, so what changes actually are being proposed? Abolition of NHS England, which people in chat are saying is like a bureaucratic, privatization-oriented subsection. Up to 10,000 jobs at risk as Prime Minister seeks to slash costs and cut red tape. Well, what jobs? Like nurses and doctors or middlemen? Abolish the independent Quango, which has run the health service for more than a decade, cutting up to 10,000 jobs. Okay, we're learning. Because a Quango? Yeah, I don't, it's not like a slur, right? The NHS's top doctor has announced he's stepping down from the role just a week after the surprise resignation of NHS England boss Amanda Pritchard. Okay, hold on. NHS England. More Quangos could be in firing line after NHS England scrapped. I'm not going to learn what this word means. If people in chat are telling me what it means, I'm not perceiving it. I don't want to know. I think it's funnier if I don't know. It's a very funny word. It sounds like a slur created by the Australians. Okay, so yeah, NHS England. What is it? The Wikipedia just says NHS. What is NHS England? Okay, BBC, tell me. What does NHS England do? Your questions answered on health reforms. Abolish to cut bureaucracy. About 9,000 administrative roles are being cut at NHS England and the Department of Health and Social Care as part of the changes. Well, that sounds good. Administrative body which manages how health services up and down the country are run, made up primarily of managers and officials, not the doctors and nurses. Okay. In 2012, they were given more independence by the Conservative-led government. Well, this seems like a good thing then. So it's a largely privatized bureaucratic middleman that the government has to go through in order to direct priorities at the NHS. So cutting it means that the government has direct control over the NHS, presumably. What is a Quango? Nope, I don't want to know. I remember what happened with the NHS COVID tracking app. I remember the fuss. Important detail here, actual doctors have been saying for years there's a huge lack of management in hospitals. My understanding, and you'll have to forgive me if I'm incorrect, is that NHS England, based on the description that I just read in 10 seconds, they don't do the kind of administrative work that would take things off the hands of doctors. They do the kind of administrative work that it would take to administrate the government's use of the NHS. So they're middlemen. Like a person at a hospital who processes paperwork is not definitionally a middleman. They might be administration, but they're not necessarily a middleman. All bureaucracies require administrative workers, right? Like that doesn't mean, like a middleman is just an intermediary, a person whose job, like definitionally a middleman's job can be cut out. Maybe a middleman's job makes things more efficient. In this case, it seems not to have, but it's their job isn't strictly necessary to the role or functionality of whatever it is that's being done, you know? And it seems like they weren't doing a good job. One of the things they do is handle transferring records between different hospitals, which is now the responsibility of doctors and nurses. Well, hopefully they find a way to compensate for that. Just make the government do it. Well, the NHS is the government, right? It's good. Unlike this outfit. It's good. I mean, conceptually, it's good. I think that's good. I'm in favor of cutting red tape and bureaucracy, by the way. Like Doge is, weaponizing people's bias towards that to dip their dick and balls all over the government and break everything. But if it's done properly, and if there's any country that would be most stricken by overregulation, it would probably be the UK. That just seems like a country that would have a lot of it. Damn, that's a lot of words. And the font's kind of small. Altogether, I guess this is a good thing. You know, I'll take it as I can. 1 second. NHS England cuts Wes Streeting. I want to see that full interview.
Wes Streeting, can we just get clear what difference all this is going to make? Now that you're in charge of the NHS, are you the person I complain to as I enter my 4th year waiting for someone to look after my dodgy knees?
Well, I think people would always, in your position, complain at the Health Secretary, at the government anyway. What today is about is we've currently effectively got 2 head offices for the NHS. NHS England, the Department of Health and Social Care, taken together, 19,000 people working for 2 head offices. Back in 2010, we had 1 head office of half the size. So what today is about is making sure that we deliver better value for taxpayers, generating hundreds of millions of pounds worth of savings by halving the size. And while I've been trying to build one team across the 2 organisations, actually just having 1 centre, 1 head office, much smaller, smarter, doing the things that only we can do nationally, and ending the pretense that all of the change, all of the improvement, all of the direction of the NHS can be driven from one person sat behind a desk in Whitehall. So the biggest devolution of power in the history of the NHS to deliver better services, better outcomes for patients.
I'm going to unpack some of that, but let's just translate the first bit of it. You're going to sack, 9,000 or so civil servants or NHS England employees. The budget for NHS England is 200 billion. You said this morning it's going to save hundreds of billions. How's that going to happen?
Hundreds of millions.
Hundreds of millions, I beg your pardon. How's that going to happen?
If they're cutting NHS England and it has a budget of hundreds of billions, I don't know how you're saving hundreds of millions. I feel like you should save billions at least.
Well, because we're halving the size of the workforce across both organisations as we create one head.
The argument leftists here in the UK are making is that this could be good, but it may also give Wes Streeting more direct control over privatisation, which he's spoken of favourably in the past. Yeah, I don't trust Wes Streeting for shit. I understand that this could be done. Yeah. It's probably not anything to be like, celebratory over. I know I say this every time, but it's so important that people understand healthcare literally does not have to be expensive. I know that's crazy, but the vast majority of healthcare interactions that you have cost nobody nothing. You go in to talk to a doctor takes a look at you. Do you know how cheap pills are? Like sometimes, there are things that are just innately expensive. Surgery, long-term care, obviously any kind of like long-term machine care, dialysis, chemotherapy, right? There's plenty of things that are expensive, but 95% of healthcare interactions are literally just, hey doc, can you take a look at this? Or, can you like test my blood for this and that? And it's just not innately expensive. It's only expensive because people need it so much that the companies that preside over all of these interactions can charge a lot for it. It's just supply demand, and the demand is infinite because it's an inelastic demand. It's healthcare. You need it to live. So because they know we'll go for it at any cost, they can provide it at any cost. Not at any cost, but that's basically how it works.
So 9,000 civil servants plus out of the door.
Yes,
Understood,
and when you put it like that, it sounds very straightforward, cold and clinical. There are thousands of decent people who work across the department, NHS England, and this will be an anxious time for them, very disruptive, and there's no way of sugarcoating the fact that there are those changes, absolutely. But we will be treating people with care and respect and the fairness that they are owed through this process. But ultimately, Trevor, yes, the NHS...
I don't know how people still labor under the delusion that healthcare is innately expensive after they get their receipt from an emergency visit to the emergency room. Have you ever been charged $50 for a single ibuprofen? Like the idea that there's any kind of authentic relationship between the value of these items and services and what people are being charged for them is completely ludicrous. You'd have to be delusional beyond. Imagine you would have to be like the most sickeningly delusional person. You are like the modern equivalent of a 13th century peasant who genuinely believes that the nobleman that rules over your land like personally loves you and cares about you because like that's what the clergyman says when you occasionally attend church and listen to a sermon in Latin that you don't speak or understand. Like you are such a cuck.
Department has a budget of over £200 billion. That's a budget the size of the government of Portugal. But I think what's happened under our predecessors is that things like the NHS England change, which former Tory health minister saying, I wish we'd had the guts to do, literally said that today, Lord Bethel. They put this in the too difficult box. Oh, it's too difficult. There's hundreds of millions of pounds worth of savings to achieve. And I know it's in the context of 200 billion, but honestly, for people watching, the idea that we wouldn't care about hundreds of millions of pounds, putting that to the front line.
Before we default to this is all the Tories' fault, the Darzi review, Ara Darzi, the celebrated surgeon you commissioned, said a top-down reorganisation of NHS England is, I'm quoting here, neither necessary nor desirable. In September, you said a top-down reorganisation was, quote, the last thing you wanted to do. Yet today, that's exactly what you're doing. What happened?
Well, we're merging the two head offices. The rest of the system,
it's a top-down reorganisation.
The rest of the system, in terms of integrated care boards and the wide range of NHS providers, in terms of the design of that system, it will remain largely the same, even if we give people much clearer roles, responsibilities.
It's kind of cool how the UK is. Like, over here in America, there are at least, like, left-leaning Democrats. Is there anyone apart from Corbyn and the Labour Party members who were kind of in his camp who are even, like, remotely against the like, ongoing neoliberal privatization? No? Okay. That's kind of gay.
Cut through some of the bureaucracy and unnecessary regulation. We'll do all of that change.
Oh, yeah, they like AI over there. Almost certain AI will cut civil service headcount, minister says. That's great.
But enablers, the tools that they need to do the job. And so, for example, on things like procurement, why would you have every single NHS provider in the country doing their research on what kit to buy and then negotiating at small scale with big companies when we could get better value nationally, save them loads of time and hassle, so they're buying into a central system? Those are the sorts of changes we should be deciding nationally. But locally, we've got to give people more freedom to design their own services to meet their communities' needs.
Let's talk about the thing that most people most care about.
I don't get it. Doesn't the UK have a Labour government? The Labour Party in the UK is ideologically possibly worse than definitely worse than the Democrats. Not like Schumer Democrats or maybe even like Hakeem Jeffries Democrats. But I would say if you took them versus Pelosi like beats them head and shoulders above. Basically, it's really bad over there. Like really, 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 really bad. Yeah, the flip side is that the Tories aren't as bad as the Republicans. So there's that, I guess. Or America 50 years from now. Don't say that. Don't say that to me.